Still ahead on KXAN News at noon, the fight against breast cancer can be incredibly difficult, but during this month of awareness, we're taking an in-depth look at some of the options to make that fight a little easier for women. Welcome back this afternoon. October, of course, is Breast Cancer Awareness Month, and doctors are on a mission to educate people and provide access to services for their patients. Joining me today is Dr. Jennifer Walden. She's a plastic surgeon in Austin. We both have our pink on today.
Yeah.
Always a good start. You actually have a personal connection to breast cancer, and I know that that's kind of sparked your interest in it, especially. If you mind sharing that.
Yeah, my mom was diagnosed with breast cancer in aggressive form at age 68, and she underwent a mastectomy and lymph node removal, as well as an immediate breast reconstruction. And a mammogram between 1 year to the next at her OB-GYN office saved her life.
Mm-hmm. Talk about the procedures that are done today. Obviously, with Angelina Jolie, I just think of her, high-profile celebrity, had the double mastectomy and breast reconstruction.
Right.
Is that a common procedure, and how viable of a solution is it?
And Angelina Jolie had a very strong personal and family history of breast cancer and genetic markers that showed that she would likely go on to get breast cancer. So she got preventative mastectomies on both sides and an immediate implant breast reconstruction. But there are a lot of different techniques and options available for people like her and the breast cancer patient. Lumpectomy, mastectomy, all sorts of different options. And so we're saving lives more, and earlier detection is occurring more.
Detection is the key, and mammographies, I assume, are still kind of the best method.
Right.
Of detection.
Mammography is a great screening tool for early or occult breast cancer. So a mammogram every year after the age of 40 is really recommended by the American Cancer Society. A clinical breast exam by your primary care provider should be done every year. And a self-breast exam, even at home, same time of the month, once a month. But self-breast exam does not replace the value of a screening test like a mammography.
Breast implants have become so common lately. How does the detection differ for people with breast implants?
That's a great question. And breast implants can impair mammography to a small amount. Certainly when they're under the muscle, we can see the breast tissue better. But it's important for women with breast implants to tell their mammographer they have implants in, and they'll do a couple of extra views to push the implant against the chest wall and be able to see the tissue better. We also have tests like MRI and ultrasound to add as adjunctive studies to see that breast tissue in women with implants and people who are at higher risk for breast cancer.
For someone that is looking to get more information, where's a good place to start?
The American Cancer Society, Susan Komen website, basically. Those are great places online to start. Talking to your primary care doctor or your gynecologist are also wonderful resources.
Wonderful. Dr. Jennifer Walden, plastic surgeon right here in Austin. Thank you so much for joining us today.
Thank you for having me.
You can also find more information in the health section of our website. Just scroll under the news tab at KXAN.com. David?